Video is on a 15-year-old male with a history of asthma and heart murmurs coming in for a sports clearance for sports physical. Important components of the sports physical: ensure safe participation in an appropriate physical activity, but also to identify conditions that may interfere with the person's ability to participate, identify any health problems that increase the risk for injury and death, and also help select an appropriate sport for the participant's particular physical status. Cardiac history, some of the questions I'd be asking are: do you have or have you had chest pain with exertion? Any syncope or near syncope? Any excessive shortness of breath or fatigue when you exercise? Do you have a family history of premature death or sudden death? Do you have a family history of a disability from a heart disease for somebody that's a close relative younger than age 50? And how long have you had this heart murmur? Has it ever been diagnosed before? Has it ever been given a grade of your heart murmur, grade 1 through grade 6? Respiratory, how long have you had asthma? When were you first diagnosed with asthma? Has there been any significant changes in your asthma since the last time you were seen by a professional? What symptoms do you commonly experience with asthma? Do you get a cough? Do you get a wheeze? Do you get shortness of breath? Do you just get fever? And then how many episodes of asthma exacerbation have you had this last year? Any hospitalizations or ER visits because of the asthma? Do you smoke or use tobacco products? What triggers your asthma? Is it pollen? Is it animal dander? Is it changes in the temperature? Is it only when you physically exercise? Have you ever been intubated because of an exacerbation of your asthma problems? Have you ever had to use steroid treatments, HOMO2, nebulizers? And then what meds currently are you taking now? And how often do you have to use your rescue inhaler? Exams that I'd consider would be an EKG to establish a baseline for this patient with the heart murmur, or to compare with a previous EKG to look for any changes. I'm going to want to auscultate the heart sounds, and I want to try and grade the murmur if it's never been graded before. Anything higher than a grade 2 would get a cardiology consult. Complete set of vital signs, and then I'm going to auscultate the lungs. I'm going to check for, because of the heart condition, check for physical stigmata of Marfan syndrome, and then also do a peak flow test for asthma. And then finally an examination for inguinal hernias for boys of his age. So based on some of the answers given during this physical, it could go either way on this, but I would probably restrict participation until we got a cardiac clearance based on the fact that he has asthma and he has this diagnosed murmur or new diagnosed murmur, and I think that needs to have a cardiologic consult before clearance. Thank you.